So, fibromyalgia is this unusual set of symptoms that the American College of Rheumatology had all lumped together to come up with a diagnosis. And before that was made back in the late 90s, I used to see a lot of patients with the same symptoms, kind of mostly women, 20 to 40 years of age, with this chronic ongoing type of upper back pain, problems with sleep, and then a little bit of depression. And there was usually a couple other things depending on the idiosyncrasies of the patient that came in, but those were the biggest hallmarks of the complaints. And back then it was easy to get physical therapy involved for truncal instability, knee pain, chronic back pain, headaches, or scapular instability. So now it's a little bit more difficult to get physical therapy approved, and it also is limited. So unfortunately, insurance has been a little tough to work with, but I can usually find a diagnosis that will be approved to at least start on the physical medicine part of getting better. That's certainly one aspect with regards to the anti-inflammatory lifestyle that I like to have my patients achieve. Activity is important. The problem is with fibromyalgia, most of my patients with chronic pain cannot tolerate starting an exercise routine because it seems to flare up the pain. And usually the pain is up here in the trapezius or in the neck, and then it shoots into the head or it shoots down into the low back. So anybody that doesn't exercise because they're in chronic pain, when I have them start a physical therapy program, oftentimes I have to tell them beforehand it's going to start a little bit of discomfort. So sometimes one of the most important things is to have them evaluated, or have that patient evaluated by somebody that will help them go through relaxing or meditation of some sort, even guided imagery, when they have to deal with the flare-up in pain, because it's going to happen. The problem is if there's no increase in activity or no attempt to get physical medicine moving, shoulders strengthening going, or stretching of muscle going, it will just get worse and worse. Other symptoms will come up, and they inevitably get to see the urgent care center doctors, the pain doctors, injections, chronic pain medicines. Without, unfortunately, some of them do good with that and get back into functioning in society, but many others will be on medicines for life. And then on their own, they'll seek out care by alternative medicine providers and hopefully find somebody good. So the objective is always get ready for a little bit of discomfort. Change the mindset of the discomfort or the concept of pain. Get into physical therapy. I always say that one of the easiest things you can impound or touch on is sleep. I think that the majority of Americans lack proper sleep. I think that we're using too many iPhones, iPads, screens late at night, too much stimulation with that light, and you don't have to be in social media. You can just be checking an email or watching a fun video or reading a book on that phone, and I think it does stimulate the eyes to interpret, hey, it's light outside, I'm not going to make any melatonin. And then when you put that book down and try to get to sleep, you might be able to close your sleep just because of sheer fatigue, but the brain does not get into its usual ritual of fast wave beta, slow wave, stage 1, stage 2, stage 3, REM, and that's I'll put a link to my discussion on SlideShare about good sleep. But if we insist on not relaxing, insist on staying up late, trying to push the envelope with internet, a screen of any sort, or eating bad food, that too can cause a high sugar load. High concentrated fructose will cause a reaction in the body even if it's a couple hours ago. Even caffeine from the afternoon, if it's late enough, will chemically stimulate the body into a reaction. And if I'm trying to help a patient embrace return to sleep as the easiest function that we can embrace, yet none of the nutrition has changed, then we're doing it the wrong way. And there goes my last concept, or last leg of the anti-inflammatory lifestyle. Activity, activity, thinking, and nutrition. Activity, thinking, and nutrition. Those are the three legs that hold a patient up to be stable and help with making those sustainable changes. So I unfortunately feel that patients don't have to see me that often. If I can come up with a diagnosis and maybe rule out anything bad, look for some nutritional deficiencies, check to make sure there isn't anything going on as far as fractures, tumors, true problems with the physical, then it's time to embrace hiring or investing in a coach of some sort. I always say this in all my videos. I think that in the time period between seeing me initially and following up to see if the plan had worked, somebody has to be, you have to be accountable. My patients have to be accountable to somebody. And that's usually a coach of some sort, whether it's a activity coach, a thinking or meditative coach, a nutritional coach, a registered dietitian. There really has to be something or somebody helping you guide into that new change. And fine, if it's too hard to do all at once, then you really have to have somebody behind you telling you what has to be done next or how to keep up with your long-term goals. So the basis of change in fibromyalgia is to move, to tolerate or change the concept of dysfunction. There are certain herbs that are very good with fibromyalgia. SAM-E was very popular back in the 90s. It still is good. I think it's more for the thinking part. Helps relax, also helps release serotonin. It's a great anti-inflammatory. And it also works as an antioxidant, breaking down into glutathione for the liver. So by all attempts, it's great. The only problem is you really have to get it individually wrapped, because SAM-E reduces, or it oxidizes very quickly when it's exposed to air. So you have to get whatever brand you get. It has to be in those little blister packs that you pop out, vacuum sealed. That's SAM-E. St. John's wort, also very good, probably a little cheaper, 3 times a day. Usually it's 300 3 times a day, and then you ramp up to 600 3 times a day. There are some nice studies that I'll put a link to that have showed at that high dose it has helped with mild to moderate depression. And then magnesium, I think, is great, but it depends on how your kidneys are functioning. Again, everybody in the United States, when they're embarking on a change, really should be on a multivitamin, a vitamin D supplement, and a fish oil if there's no side effects to those 3. And then the other supplemental nutritional changes depending on the most predominant symptom. Sometimes there is, mostly because of the pain, that seems to be the biggest focus. Have to have people relax or take care of the spasm and the resultant increase in spasm because of the new activity they're embarking on with physical therapy. So a topical is nice, and I'll put a link to the topical section, or at least a tutorial on topical application of pain relievers. But bottom line is, with fibromyalgia, it's not just it used to be called a diagnosis of exclusion, a wastebasket diagnosis. That is not the case. It is truly a problem. I was going to say it's truly several symptoms, but it's truly a problem, but it expresses itself differently in everybody. Bottom line is, you shouldn't just say it's a waste. Don't take anything that a doctor says when they say it's a wastebasket diagnosis. Just go ahead and start dealing with the pain. That is false. It's not the right way to approach this. I have had even men come see me with a diagnosis of fibromyalgia, and usually I can get them on their way to functioning back in society better, or functioning back as a parent or a spouse much better than before. But again, it takes evaluating, it takes listening and a keen ear to figure out what's the priority here and what's missing and when did it start. And then, again, coaches are invaluable as far as helping with making the change between visits to see me. So hopefully this helps with regards to what fibromyalgia is, a basic, and you can find the definition online anywhere. The American College of Rheumatology will have it, and that's a black and white diagnosis or definition, but again, everyone's individual. There's different ways it presents, and whether it's the primary diagnosis or a secondary diagnosis and there's something else is big, like thyroid disease or irritable bowel syndrome, it's still important to treat, and I think my approach is one of the easiest ways to kind of keep on plugging away, taking care of physicality, taking care of pain flare-up, taking care of relaxation therapy, taking care of nutrition, then going back to the physicality again. I think that's one of the easiest ways to slowly step back into the swing of things so you're young and not suffering anymore.